I'm pleased today to learn from Dr. Lisa Cooper. She is a Bloomberg Distinguished Professor at Johns Hopkins University Schools of Medicine, Nursing, and Bloomberg School of Public Health. She is also the James Fries Professor of Medicine in the Division of General Internal Medicine and a core faculty member in the Welch Center for Prevention, Epidemiology, and Clinical Research. She was born in Liberia, where she witnessed the effects of social deprivation on the health of many of her fellow citizens, and developed a passion for her career in medicine and public health. Dr. Cooper was one of the first scientists to document disparities in the quality of relationships between physicians and patients from socially at-risk groups. She then designed innovative interventions to improve physicians' communication skills, patients' self-management skills, and healthcare organizations' ability to address needs of populations experiencing health disparities. She has authored more than 300 highly cited and influential peer-reviewed publications and several book chapters, and is the recipient of an extraordinary number of honors and awards, too many to mention here. As the founding director of the Johns Hopkins Center for Health Equity, where she and her interdisciplinary team collaborate with multi-sector partners to implement rigorous clinical trials, identifying interventions that alleviate racial and income disparities in social determinants and health outcomes. Dr. Cooper is a lifelong Methodist. While serving on the Wesley board, she helped us develop our Heal the Sick certificate program for congregations wanting to engage in public health in their parishes. Over 500 people have completed the certificate nationwide. So, Dr. Cooper, it is so good to see you again and hear what you're doing. And that really is my first question. What are you working on now?
Well, David, it's great to be with you and to see you again. And I'm continuing to do work on addressing health disparities in underserved communities. As you know, I've always focused on chronic diseases, has been my main focus, but I direct a center where we have people that actually do work on a variety of populations, all the way from children to pregnant women, and then we have adults, middle-aged adults, and older adults. So right now, my biggest project is actually an NIH-funded center focused on cardiometabolic health disparities. So that's heart disease, diabetes, kidney disease, obesity. Those are the cardiometabolic conditions, and we're testing different interventions. So we have 4 different trials going on. These are real world trials, so not sort of the typical clinical trial where you have healthy people who volunteer, but these are trials that are going on kind of in real world settings. So for example, one of them is enrolling pregnant and postpartum women who are getting home visiting services. And another one is working with people who are in community health centers who are going there for treatment of their hypertension and diabetes and kidney disease. And then another one is working with people who are trying to change their diet and are trying to eat healthier, more fruits and vegetables, following the DASH diet. And then another one is more for folks who want to increase their physical activity as a way to improve their cardiorespiratory fitness and prevent the development of heart failure. So these are the programs we're working on. They're across the state of Maryland right now. And that's why the grant program is called the Mid-Atlantic Center for Cardiometabolic Health Equity. And then those are my US-based studies. And then I actually have a couple of projects going on in West Africa as well, also focused on improving the diagnosis and management of hypertension for people who are living in impoverished neighborhoods or are kind of under-resourced.
Here in West Africa. Is it in Liberia? I know that you still have family there.
Yes. So one project is in Liberia. That one we're hoping to use mobile health vans to go to communities where people find it difficult to actually access healthcare and to provide care to them right there in the community, delivered by nurses. And then the other project is based in Ghana and Nigeria, and that one is more of a health system focus, but we're using cell phone technology to sort of facilitate engagement of people with nurses to sort of get over that barrier that people have of traveling long distances and also waiting for very long periods of time to be seen by a doctor because there's such a shortage of health professionals.
That kind of real world trial has got to be magnitudes more difficult. And you must have people on the ground and in the streets who are just really good at making that happen.
We really do. We look for people who have who have that kind of interest and talent and who can make connections with people from those communities. We also spend a huge amount of time talking with people, leaders of these different organizations and community leaders, and actually jointly developing the programs that we are going to test because we don't want to just sit in our offices and our research labs and come up with things that don't work for people. So we actually co-develop a lot of those programs, and it involves a lot of kind of talking to people and making sure we incorporate different perspectives and kind of compromising on different things. So it's a lot of relationship building, and that's actually one of the reasons I really love doing this work is because I'm a person that always has prioritized relationships.
It's interesting. You may know the work of somebody else at Hopkins, Allison Pugh, who's written her book on the last human job, and
Oh,
and
wow.
she talks about that,
Wow.
the rewarding, but it still has to be very um, difficult, and I wonder if it drains you. And have you found that your faith is what sustains you, or how have you lasted so long at this work?
I know sometimes I ask myself the same question, but when there's no question that my faith helps to sustain me in this work, and I think has actually provided like kind of the foundation for everything I do anyway. Always felt that medicine and public health were more of a calling than just a job for me. I always felt like it was something that I was meant to do, and um, especially I think because I think one of my strengths is my compassion and empathy, and I like to think I'm a good communicator, so I think I've used that pretty well in my work, and so I combine that with my sort of natural sort of curiosity and interest in science
Uh,
and that and my humanistic sort of interest to bring service to communities and to individual people when I deliver care to them as a physician.
well, in addition to your tremendous education and experience, I've watched you work, and as I'm in the middle of this book by Dr. Pugh, and she talks about the importance of really seeing the other person. That seeing is very critical to this connective labor that she talks about, and you seem to have that.
I like to think so. It is something that I think is a lifelong journey that we're always working on, getting better at those things. The other thing, though, I don't know if I probably told you this before, but I also worked on a book in the last 5 years too. So I do tell a lot of my story in that book, and I've been going around and kind of talking to different groups about the work and about where people see themselves in some of the solutions. So it's gotten me away from talking to just health professionals to also talking to people in other areas, whether it's like business or even like the arts and of course like policy people. So I think that's one of the ways in which I've really grown over the past 5 years. I would say it really kind of really blossomed during the COVID-19 pandemic, when everyone seemed to be much more kind of aware of the fact that, you know, we're all interconnected and that
Uh,
health is like such a critical part of everything we do.
Tell us the name of the book.
The book is called Why Are Health Disparities Everyone's Problem?
Okay. Well, let me turn to a more troubling aspect of the current situation. What do you fear will be the effects of the federal government's withdrawal of monies from medical research and now the proposed reductions in Medicaid? That must be hitting you at both ends of your work.
It really is. Well, you know, so when it comes to research, I'm really concerned that a lot of the funding for research, particularly in health and in public health, but for almost all of the nation's research, most of that funding comes from the federal government. And you know, some of it comes from philanthropy and the private sector, but um, a lot of research that is not meant for you know, business purposes or for earning income, but is kind of research that involves taking some risk because people are trying things that have never been tried before. And, you know, maybe there's not an immediate payoff from the research. That most of that comes from the federal government. And right now, because a lot of that research, the budget has been cut like by a significant amount, almost like half. Um, that, you know, clinical trials where people are actually enrolled and people who come from underserved communities actually gain some access to medications and to different services through that research. Those clinical trials are being cut off, so people are losing that access. Um, we're not going to develop solutions to a lot of the existing problems. We've known that our country suffers because we have lower life expectancy than many other developed countries, because we have such large inequities in health and health outcomes in our country for particular groups. And if we don't continue to try to investigate that problem and come up with answers to it, we're going to fall further and further behind, and people are going to die and suffer a lot. I hate to be so grim about it, but that's just the truth of it. And we've already seen it happening here and also overseas.
Yeah, yeah, yeah. Well, what would you say to those who are watching this, who are men and women of faith involved in congregational life? Of course, people of faith can use the power of prayer, the public square,
Mhm.
and the ballot box, but I'm not asking you to comment on the politics of this situation right now, but let's suppose government funding does not return to public health at the levels it has been. What can congregations and denominations and individual Christians do to help fill the gap?
Yeah. So I think that, you know, faith communities have been filling the gap for a long time. And so I would say they can continue to do that by being a place where people can come. They can open their doors and make it a place where people can, health professionals, for example, can offer services, whether it be screening or things like preventive treatments like vaccinations, um, that might be available at you know, reduced costs, or you know, they can work in partnership with other like foundations and other nonprofits to do that. I think they can sort of fill in the gap in terms of other people's other needs, because really, in order to be healthy, people don't only need to go to the doctor, but they need a safe place to live. They need to have food. They need to have, childcare. So all those kinds of things are things that communities of faith can really assist with. And more than anything, people need connection and, access to information and knowledge, and definitely churches and faith communities can provide that.
In our Heal the Sick certificate, one of the points we make is it's certainly helpful to ask if you're taking your medications, but it's also helpful to say why you care that they're taking their medications.
Right. No, absolutely. I mean, I think, right, more important is what's important to you and what's worrying you most. And that will tell you a lot more about why someone is or isn't taking their medication, right?
Is there anything in this time, and you can't turn on the news without seeing something else that makes you worry? What gives you hope?
Yeah. Well, I think one, my faith gives me hope. I always know that no matter what comes, that God is there and is always there to give us strength and to help us to deal with the hardships we face. But God also works through people. And so I think that also gives me hope, is when I see God working through people, just the kindness and generosity of people, the love and care of people, whether they're my colleagues or my community partners, because we have a large community advisory board that informs our work, and we check on each other and support each other through a lot of our different activities and our challenges, celebrate our successes and our blessings. So it's really the people, the relationships, and my faith that continue to give me hope. I really believe, I think, in the fundamental goodness of most people. I think most people want similar things. They want to feel loved, they want to feel safe, they want to feel connected, and they want the best for their families and their loved ones. And I think a lot of what we're seeing now is just kind of a disconnect between what people see as the sources of the blockages to that, and what the answers are to that. And the more we can get to know each other and sort of be there for each other and see the humanity in each other, the more likely it is that we will be able to not necessarily agree on everything, but at least treat each other respectfully enough that we can come up with solutions that work for most of us, or that at least don't leave a lot of people, on the periphery, which I think is what's happening now, unfortunately. I mean, I know this isn't a political conversation, but I think a lot of people are not getting the right information. They're getting misinformation, and the messages they're getting are playing on people's fears and sort of bringing out the kind of not the best in people.
Well, I couldn't agree more, but I have to say, just before we started taping this interview, I said to somebody, I can't wait to talk to Lisa Cooper. I know she's going to make me hopeful that she's still working in the world. So I want to thank you for this time and for the work you do. We appreciate it very much.
Thank you so much, David.